get it.
Welcome to the New Testament Church of God YouTube channel. I'm Corinne Barnes, and I'm pleased to have with us today Dr. Stephanie Fletcher-Lartey. Dr. Fletcher-Lartey is joining us from Sydney, Australia. Welcome, Dr. Lartey.
Thank you, Dr. Barnes. It's a pleasure to be here with you today.
I should point out that Dr. Fletcher-Lartey is, first of all, a child of God. She's a Christian, a member of the New Testament Church of God. She's a pastor, but she's also an epidemiologist with about 24 years experience in public health. She started her career here in Jamaica in St. Mary, but is now living and working in Sydney, Australia. Dr. Stephanie Fletcher-Lartey. Australia is a very long way from St. Mary. How did you get there and what are you doing there?
Thank you. I actually came to Australia in 2009 when I was blessed to receive a scholarship from the University of Technology, Sydney, to pursue a Doctor of Philosophy degree here. I was very blessed to have that privilege. And so while I was working as a public health inspector and a regional environmental health officer in Northeast Regional Health Authority, I was fortunate to apply and successfully receive the scholarship. So I came to Australia in 2009 to undertake the PhD, which I finished in 2013. And then I decided that since I had no strings attached back home, it was in order for me to stay in Sydney. So I decided to stick around a little bit. Most people seem to want me to stay here. So I did stay back and I got my first job working in the university in the WHO Collaborating Center for Nursing, Midwifery and Health. And then after that, I went back into mainstream public health, where I worked as a public health epidemiologist for the New South Wales Ministry of Health. And I've been here ever since. And since then, last year, I was actually back in the Caribbean, working for the Caribbean Public Health Agency as an advisor on their emergency response and communicable disease. So I was actually in the Caribbean last year, all of 2020. I'm back here in Sydney since December 2020. And I am, as you see from my title, I am leading the COVID-19 study for the Burnet Institute on behalf of the government of Victoria.
So you're well placed to speak to us about COVID-19 and vaccines.
Hopefully I should be able to make a mark there.
Because that's what we want to talk about. COVID-19 and vaccines, a very topical issue. I mean, it's on everybody's mind throughout the world. It's a pandemic, so no country is prepared. So I really want to start, you know, I don't know if you're in Jamaica actually when we had our first case. It was on the 10th of March, 2020.
I was in Trinidad actually because I was leading the COVID response. So my department that I headed up was the department that leads the communicable disease and emergency response. So we were very much the first people who knew. In fact, the first case was diagnosed in my institution, I believe. So we were fully aware of the first case.
Yes, I remember, I think most people remember where they were and when the announcement was made and how our lives just changed immediately. Yeah. And nothing has been the same since. But the vaccines have now been developed. We have, well, the United States has 3. There's Johnson & Johnson, there's Pfizer, there's Moderna. And in the Caribbean, we're more familiar with Astrazeneca because that's the one that we have been administering. But I know that there's a lot of fear and suspicion about the vaccines themselves, and particularly the AstraZeneca. Are those fears justified?
Well, what are the fears? You know, maybe explain a little bit more what are some of the fears that people are having about the vaccines?
Well, now, especially with some European countries, I mean, Germany, France, and some Eastern European countries, you know, saying that some people have actually been administered the vaccine and they have developed blood clots and other illnesses. And so people are wondering, is it safe to take the vaccine? And some people are thinking the AstraZeneca is a substandard vaccine, so that's why we're getting it in the Caribbean. So there are these fears surrounding the vaccine. What would you say to those people? Are those fears justified?
All right. So essentially, this whole pandemic has been plagued with a lot of fears from day one. So I suppose the fears that we are seeing right now is a spin-off or a continuation of what has started more than a year ago with this fear mongering, I would like to call it. And people have just been on this high, like literally drunken with fear for more than a year. And so almost anything will trigger them off. Some of the things that, would not normally trigger people off are probably triggering them off now because they have been immersed in this kind of atmosphere for a long time. So with the AstraZeneca vaccine, this is the one that was created by the University of Oxford and AstraZeneca. So it is a genetically altered virus with a coronavirus protein that activates the body's immune response. And it is estimated to be about 62% effective for preventing symptomatic infections, or about 40 to 55% of illnesses when you have 2 doses at least 4 weeks apart. Now, these vaccines, they are much, because they have been produced using a cheaper type of technology, that is the reason why initially the cost for these vaccines are less than the others, because they're coming out to be about $10 per injection. And because they don't require that strict cold chain like the other vaccines. So for the AstraZeneca vaccine, you can keep this in your standard refrigerator for up to 6 months. So yes, it may seem inferior, but it's in truth and in fact, if you compare this with the regular childhood immunization, the vaccines that we get through that, it basically compares when it comes to the storage in terms of the refrigeration. So what we are seeing here is not different. So the fact that there might be some new types of vaccines that require this significantly cold temperature does not make the AstraZeneca vaccine inferior from that perspective. The fact that also the effectiveness is not as high as that of some of the other vaccines does not also make it inferior, because what we need to understand is that when they do these clinical trials, and maybe I should get into a little bit of details about some of that, when they do these clinical trials, they test to see how well the vaccine candidate is able to prevent illness in different types of people. But there's one unique thing that we probably did not realize, is that when the AstraZeneca vaccine was tested, that was after both Pfizer and Moderna. And as a result, the Pfizer vaccine and the Moderna vaccines were tested long before we had some of these new variants. And so they were tested on the original virus. AstraZeneca, on the other hand, came out months later after we already saw some of the new variants coming out. And what we are seeing is a better picture of how well these vaccines do against some of these newer variants. And so these vaccines were tested in, say, places like South Africa and Brazil, where we are having some of these challenges with the new variants. And so what we should realize is that this vaccine, while it is saying 62% effectiveness, it does still protect a significant proportion of the population when we put it in the context of the different variants of the virus that are in circulation. And so I don't believe that we should consider it as an inferior vaccine. And also remember that for most vaccines to work, we need something called herd immunity. So the more people in the community will become vaccinated, the better that vaccine will work. So instead, my recommendation would be, instead of yielding to these fears and worries about the vaccine, the more people who want to be vaccinated should get vaccinated so that we can have a better protection for the community. So that would be my take on it. And the last point would be in terms of the clots that people are worried about. See, most vaccines will, you know, will have some kind of side effects. That basically you will have some mild reactions to the vaccine. And that usually happens at the site of the injection, you know. So when people get injected, some people will have